Hello, let us now know what is skull and what are its subdivisions. Skull should always include the mandible. If mandible is removed, it is not skull, it is called as cranium. And the upper part of the skull, which we call it as the skull cap or brain box or even the calvaria, and the boundaries of that is supraorbital margin. This is supraorbital margin in front, zygomatic arch at the sides, margins of the ear, the nuchal lines and external occipital protuberance. The portion above this is called calvaria and the soft tissue covering the calvaria is scalp. If you remove that calvaria, it will be like this roughly, and this is that portion of the skull which cannot be called as a skull. Instead we call it as facial skeleton, which again is divided into upper facial skeleton, and this one alone forms the lower facial skeleton or lower jaw or the mandible. Now coming to the total number of bones of the skull. Totally the number of bones in the skull are 22, of which 6 are unpaired and 8 are paired. The unpaired bones are the frontal bone in front, the occipital bone behind, the vomer bone in the nose, the mandible itself, and number 5 is sphenoid bone and number 6 ethmoid bone. I repeat, frontal, occipital, vomer, mandible, sphenoid, ethmoid. And the paired bones are 2 parietal bones, 2 temporal bones, 2 zygomatic bones, 2 maxilla, 2 nasal bones, 2 lacrimal bones, 2 palatine bones inside and 2 inferior conchae. So these are the 8 paired bones. Total it makes to 22 in number in the skull. Now coming to the anatomical position of the skull should be held in certain position, which is the anatomical position of the skull, for which the inferior orbital margin and the upper margin of external acoustic meatus should lie in same horizontal plane. We should keep these two in the same horizontal plane, and that is called as Frankfurt's baseline, since it was introduced or discovered at Frankfurt's conference. Hence the anatomical position of the skull is Frankfurt's baseline. Thank you.